Hi, welcome to Blood Talk Small Talk, where we aim to provide a deeper understanding of the teamwork it takes to ensure quality care in a healthcare setting. Tune in for a mix of serious science and casual conversation, and you might be surprised to learn just how much goes on behind the scenes. I'm your host, Marz.
I'm your host, Peach.
So I'm quite excited for today's episode. Like our slogan entails, Blood Talk Small Talk tries to highlight the teamwork and each department's different roles they play in patient care. In today's episode, we have a very special guest who started as a lab assistant, stepped up to become a phlebotomist, and now is taking her biggest challenge yet, nursing school. Bridget, would you like to introduce yourself?
Hi, my name is Bridget.
Background? Even though we already described what you're going through, any more background? No?
Yeah.
uh, I guess the future will awaits. No, just kidding. At the moment, no. You kind of you kind of hit every role that I played so far.
All right. Okay. So today we'll be focusing on life as a lab assistant. I guess we'll just jump right in. So, what sparked your interest in working in the lab?
Actually, so I originally went to phlebotomy school, and
Mm,
a lot of other
mm.
hospitals they consider their phlebotomists as lab assistants. So when I was looking for a job, I was like, okay, well, let me also kind of look up lab assistant, and I like came upon like a website that had an opening, and I applied. And I think like later on I got a call saying that they wanted to interview with me. And yeah, it totally did not have to do with phlebotomy at all. It was actually very different. so
Oh,
Oh,
so you got I guess, phlebotomist license first before you were a lab assistant.
right. Mhm.
oh, and then you switched to phlebotomy sometime in between. Oh, I had no
Yeah.
idea.
I thought it was like the other way
Yeah.
around. I thought you work in lab assistants and then become a phlebotomist. So what do you do before that? Like before even like phlebotomy school? Like what even bring you to that?
I actually worked with kids. I worked at a school as a teaching assistant. Very different, yeah.
Yeah, very
Oh.
different.
Yeah. But my whole family is pretty much in healthcare. My dad's a nurse. My mom and him worked at the same hospital for like years, the same hospital. So,
Mm.
and then I was like, okay, well, I guess I'll look into nursing. So I've been doing that the entire time. And then as a teaching assistant, they require you to go to school and get like the credits. It's like a whole program. But yeah,
Mm.
so I was just been doing prerequisites this entire time. And then yeah.
Interesting.
So, let's see.
Wow.
Yeah.
So, like, what's a typical day? Like, well, since we like, today we're focusing on lab assistants, right? So, like, what does a typical day looking like for you as a lab assistant?
um so in the department that I work in, we pretty much process tests. So whatever the doctors want to order, we kind of look into different other performing laboratories, including within the hospital that we work at, to see if it's something that's ran either what we call in-house or what we do as send outs. But there's different branches. Like we take care of the ER specimens, whatever comes through the window, which is like outpatients and inpatient, body fluids, blood, whatever
Hmm.
comes from within is what we get.
So I
Yeah.
think
In and
Yeah.
out.
we I think we need to highlight a little bit about the different departments in the lab since we're talking about lab assistant. This is something that hasn't been like brought up before in any previous episode, and I think there's a very big misconception about what the lab entails. We've talked a bit about like micro, blood bank, and core lab, but everything basically after patient sample, the first stop or after collecting the patient sample, the first stop is specimen processing, or what's the other word that it goes by?
I guess specimen receiving. I seen some
Yeah.
hospital
Mm,
using that terms like receiving,
mhm.
central
Yeah.
receiving.
So
Uh,
Bridget's department goes by specimen processing, specimen receiving, and then send out lab. So this is the very first stop where everything goes before it goes to their respective
like separate
department.
ways.
And then,
Yeah.
do you want to talk a little bit more about like what goes on in specimen processing and receiving? I guess. So,
Mhm.
like,
Uh,
after phlebotomy or like the patient actually drops off their own samples sometimes, how do things, I guess, get processed?
I guess we're pretty much, yeah, like we are the first people that receive the specimens, and we're also kind of like the last line of defense before it goes out to like different laboratories. So yeah, I guess it's pretty important as a lab assistant to be like vigilant of the specimens and the tests that come in, and if it belongs to the right patient. Yeah,
Oh
obviously super
yeah, that's
important.
so true.
Yeah,
I seen like countless time where actually like processing people helps like stop or catch the mistakes early on. You know, like if the specimen has mislabeled. What I mean by mislabeled, they come in like different forms, right? There are like sometimes you have two patient label on the same specimen.
correct.
So like if it, you know, you get missed pass on, then the longer it will get delay. So the sooner they catch it, the sooner we can like, you know, trying to find like the nurse if that's what's like, you know, brought it down from the floor, or like call the patients, have it recollect or something like that. So yes, like Bridget said, it's like almost last line and almost, I guess, last line defense in terms if you're looking from the outside of the lab, but like first line of defense from like the lab perspective, because you know you're the first department who receiving it and like separate into different locations where they're supposed to go to. So it's very important.
I guess we should say more so like internal laboratory, because phlebotomy is technically still part of the lab as well, but it's like they're the ones most exposed, and then what is it, specimen processing is like the most superficial on the surface. I think that's the I made a lab week video. If people somehow have found it or you want to search for it, it's somewhere around there. I'm not going to tell you where it is, but you might be able to find it. But the way that I structured it basically was like the process of going through the different departments. So, phlebotomy is the ones that encounter the patient first, and that's the very first part of, I guess, the lab. And then heading into receiving is just the next layer before it splits off into the other ones, which nobody really knows what goes on in there, right?
Yeah,
but,
Yeah.
um,
yeah.
but anyways, next
Like
question. Sorry.
actually, like Bridget, do you know what lab assistants do before you wear a lab assistant? Do you know what it is? Like, do you even know what you apply for?
No, not at all. I, I mean, I thought it was phlebotomist, but I mean, I don't know if it goes with other medical centers, like if they have laboratories, if their phlebotomists do the same things that we do. Maybe they do, um, but not a, yeah, no. I was just like, well, I'm just trying to get exposure in the healthcare field, and when I went into interview at the hospital, I pretty much like begged to get the position. I was like, please give me this chance. And I was very lucky in
I'm
to
glad
have
they
gotten it.
did.
Yeah. It was good.
Yeah.
What about you, Peach? Because you were a lab assistant before. Did you know what you were getting yourself into?
Actually, I did because before lab assistants, I was a volunteer.
Oh.
Mm.
So I volunteer in the lab. So I already know what lab assistants, you know, would be. And then, yeah, that's why I was wondering if people know what they get themselves into when they're like, oh, I want to work in the lab. However, I would say though, things are really different between clinical and research lab. I was in research lab
Oh.
before clinical.
Uh huh.
And when I first came to clinical lab, Bridget, you know how like sometimes you have to aliquot
Mm.
and then put it in like 1 ml or 2 ml? It's just my camera. Sorry.
Okay.
Yeah.
Cool effect.
It's
Yeah.
like, yeah, how like you have to aliquot into like different tubes. In my research lab, we really like when it's at 1 ml or like even like 1 microliter, 2 microliter is we have to use calibrated pipette, and it's really have to be exact amount. And then when I come to clinical lab, they just use like the transfer pipette. I'm like, is this okay?
Mm.
Yeah.
Yeah, or like in blood bank, they're just like, oh, just drop. I'm like, drop?
Eyeball it.
Yeah,
It's like
I follow
cooking.
it 3 drops. I'm like, 3 drops? Like, I mean, some people they would think that that's kind of specific enough, I guess, like, how many drops, but like to me coming from research lab, it's not specific at all.
Yeah.
But did you know that when you're like using drops, like the dropper, for example, eye drops or the transfer pipette, if you're holding it directly up versus to the side, those drops are not equal. So it's
Yeah,
like
they're not the same. That's
Good to know.
I'm like I'm like, drop? Like, you want me to drop? And I was like, yeah, put it in. And I was like, are you sure? I'm pretty sure I must have annoyed my trainer at the time because I so hesitate to put in, like, when the instruction said 3 drops or like 1 ml, and then all I had was like the transfer pipette. I mean, don't get me wrong, the transfer pipette does have like a mark that would tell you, but it's not a calibrated pipette. Like the precisions are different. But yeah, I have to like get past it because
I was
I mean now I'm used to it.
I,
It's just like at the beginning. So just one. That's why I'm just asking that question. Just if people know what they get themselves into, I guess.
I had no
I
idea.
I feel
My
like
first day, I came in with like a giant ass notebook to take notes, and then I was like, there is no room for this thing. Yeah. So also had no idea. But sorry, go ahead,
Mm,
Bridget.
as a lab assistant, you mean?
Yeah.
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 Like very first day, had no idea what I was getting myself into. I was ready for like actual, I guess, uh like how it would be for like a college lab, university lab that
Yeah.
goes along with your
Oh,
lecture.
okay.
Like I
Yeah.
had a spiral notebook and everything and was like ready, my whole pencil case, and it's like, oh, everything's like 30. You shouldn't bring that much stuff with you.
Yeah.
Was so shocked. And it's like no pencil. But I used to love use writing with pencil. It
Yeah.
was like weird. Yeah.
Yeah. I mean, even the way they cross things out in the lab, you have to like
Oh
cross it out with
yeah.
one line, initial it. It's different. Yeah.
Mm-hmm.
Did
It
you
was
also start off in receiving Mars or no?
Oh, I was in core lab. But
Okay.
then I
Okay.
I did do like 1 day or 2 days training in processing, and just remember having to do the 24-hour urine, and I gagged so hard.
Uh, uh,
What hard?
yeah.
What do you mean? Can you
I
describe?
was like try because the thing it was so a 24-hour urine is basically like they want to do testing on how much of a certain analyte the patient, I guess, yeah,
Output?
output over 24 hours. So the way that they'll collect it is a start time and then 24 hours and then collect every time they go to the bathroom until 24 hours later. And it's in this container that has like no preservative. They just put it in the fridge. But the thing is like um because they need to do a calculation with the entire volume of how much like the patient went to the bathroom, there are lines on the container, but this particular patient that I was the first time I processed the 24-hour urine, it went above the lines. And so I had to pour it into like a graduated cylinder. And when I opened it, I was just like, no.
It's super concentrated. Yeah. The
And it
urine is very
smells
concentrated.
so bad.
Yeah.
And this was like my first time working with urine.
Oh wow.
So I
My
was
least
just like,
favorite bench.
I can do it no problem now, but like actually I don't think I could handle 24-hour urines. If I had to process like the container for 24-hour urines, I think I would cry or like gag severely, but like doing a regular UA, that's fine. No problem. Sometimes you get the ones that like smell really bad, but I've learned to like not breathe through my
Hold.
nose. Yeah, when
Yeah.
I'm
Yeah.
aliquoting and pouring off urines, I've learned to not breathe through my nose, but like sometimes it'll just hit you and you're like, oh,
Yeah.
anyways, yeah, 24-hour urines are that I feel like is one of the
Hardest
to
for
process.
lab
Is it?
Yeah.
assistants.
I
Well,
mean,
what do you think?
I when I'm on urine, I it's my least favorite bench, honestly. Just because, yeah, like I have a weak stomach for urine. I think it's messy.
Oh yeah.
Yeah, it's a pretty messy, like just in general, if you're not careful. Like if you put a barrier between when you're aliquoting the urine, sometimes you'll see a splash that you probably wouldn't see if you didn't have that, protection
That's
in front of you.
why
Yeah, exactly.
safety is
Exactly.
important.
Yeah. But 24-hour urines are,
Face shield.
I know
yeah, there's
people
no
who
preservative in that container. So,
And like I can't tell you guys enough like how often I would seen people not use the protective shields, and like in my head I'm like, you don't see those droplets. Like
right.
it's there for a reason.
okay, I pour far.
And
Yeah.
yeah.
So, can't escape the smell,
Oh,
but at least try to escape getting contaminated on your clothes. I mean,
It's
it
okay.
falls,
yeah.
It's not poop.
Yeah.
Yes, that's true. That's true. So like we tangented a bit, but let's kind of come back.
Oh,
So
yeah.
after you start working as a lab assistant, how long were you like work as a lab assistant before you kind of go back to phlebotomy?
So I started in 2018 as a lab assistant. Mind you, I did have my phlebotomy license, and the plan was they were the people that had hired me were like, all right, let's just get your foot in the door, start off as a lab assistant, and once your license comes into the mail, we'll process you as a phlebotomist. Like, we'll get you in there. Um,
Mm.
I don't know. I think part of me was just like, oh, I've been training for so long, might as well just stick this out. And then I think someone probably caught like wind that I had my license. And so they spoke to the supervisor at the time, the phlebotomist supervisor at the time, that I had my, like, phlebotomy license. And I mean, almost every day he's like, hey, when are you going to come join us? When are you going to come join us? And he was very close to my lab assistant supervisor. So they kind of were like, let's get you in there. Let's see what you can do. So I was like, all right, let's go.
Because
And
I think I do recall that you sometimes did both. Like you would, if they were short, you would go over there. If processing was short, you'd come over there. But then once you got like the permanent position, that one was for lab assistant and processing, right? Mm.
yeah, I think they were trying to experiment because technically speaking, a phlebotomist could do lab assistant work because you don't need technical training for that. And whereas like a lab assistant can't do a phlebotomist job unless they
Mm-hmm.
have the certification. So they're like, well, let's see if that we can cross train her and if she can do like both. But yeah, it was hard. Switching
Mm-hmm.
back
Uh,
and forth. So
oh yeah. May I
Yeah.
ask why it was difficult?
I think because it's so busy. So for like half the day, I'd be in phlebotomy, and then processing would probably need me to kind of cover for like either like breaks or if they were short and staff wise. And so when I would go to processing, they'll be like, "Hey, actually, we have this many people leaving a phlebotomy. Can you come back?" So it was a lot of like jumping back and forth. A little exhausting.
I think I do
So I
recall
guess
that.
because you always covering like when they're short,
Right.
right?
Right.
Because
Side.
like if you stay at that locations for the whole day, maybe there are busy time and then there are like some slower where you can catch up. But since you jumping, you only jump when it's busy, or they only call you when during the busy time, so you feel like you're burning out,
Right. Right.
right?
Yeah. And I think at the time I was like the only one
Who could do
doing
both?
that. And I
Mm.
think that they started. I mean, I don't know. I guess they thought it worked because I think they ended up bringing in the phlebotomist, kind of doing the same thing, coming in mid shift, but coming from the ER to the outpatient lab.
Oh, yeah, 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 yeah. I do recall there was. We used to be so busy in phlebotomy that even the supervisor would have to draw sometimes. And then
Yeah.
I think one of our people from, was he still core lab or point of care at the time? He also used to do phlebotomy because he on his second job he did phlebotomy. That's interesting. I do recall like we also have a couple.
Mars, your mic it's really low.
I'm just talking quiet. I do recall, however, that there are a few there have been a few people who started as lab assistant, got their phlebotomy license like internally, and then if we're short lab assistant, they'd go down and do that as well. So it is, I think, very beneficial. We somehow always are short phlebotomists as well, so it's like a very good license to have, even if your title is only, I shouldn't say only, even if your title is lab assistant, at least you can do multiple things.
I
Um,
still renew mine, so
that's good. I
yeah.
wish I still
Yeah,
knew how to
and
draw.
I mean, me too. I'm gonna need it later.
Just
None of
kidding.
the yeah,
it's just stab.
yeah,
That's what
yeah.
Mark
Just
It
kind
says
will
of
come
all the
out.
time.
shoot for the stars and hope you land in the sky at least.
Yeah, just pray.
That too.
It's a lot more into that, okay?
It's like
It's not like
I don't train like that. Yeah. It's like,
yeah, I mean, it's a lot of technique actually that go into like drawing blood. Which we can get into that next time. So like okay, now like if you like receiving specimen, right? Then what do you do? Like after like okay, you're handing me like this thing.
so for my department, we're broken up to different stations, usually because during the day it's a little busier. So we have different stations for every lab assistant. So the person that usually is at the window is going to be the first one to look at everything that comes in. If the tests
Mm,
are matching the body fluids, if there's a label on the specimen, and it usually, luckily, like our labels usually tell you where something's supposed to go in what department. So
mm,
it'll say like send out or chemistry, hematology, so things like that. And we have like places where we break it off. You know, we have like our microbiology section. ER is a completely different side, things like that. So it just kind of
mm.
depends on the test that you receive at the window.
And like what priority would you in what priority would you process the specimen?
First and foremost, for sure, stats, which is anything coming from the ER. But sometimes the phlebotomist will go onto the floors and draw things like from or blood from like the ICUs or even specimens that are we consider irreplaceable. So like CSF fluids, body fluids, yeah. Pretty much what's replaceable to the lab at least would be like blood, urine, stool. Anything
Mhm,
outside of that, yeah, like I think body fluids are take priority just because of the stability, like cell count.
mhm.
Even though when we receive like a cell count from a body fluid to like a different lab, I want to say maybe the stability is like 24 to 48 hours. So it's pretty critical that like you, as a lab assistant, you have to know what times the couriers come and pick up because you have to get out certain tests so they can be ran. You know, even like with what was that other test that we used to have? It was
Oh, muscle
cyto
biopsy?
cytotoxicities.
Cytospin.
Yeah,
Yeah.
cytotoxicities. There you go. I think that was probably like a 12-hour stability. Like you needed to get a courier in there fast as you can, and they're only open for
No, I
certain
think
times.
you have
So,
to process within 2 hours.
oh, okay, yeah. That's why we ended up switching because they would never make it to the outside reference lab like ever. They were always
Hmm.
canceled. So, yeah.
Yeah, because like you said, like this. Well, okay, the stabilities is um, I think you have to finish in 12 hour, but the prime window, they said you have to get it to within the 2 hours, so that I think maybe they put preservative where they do something. Um, yeah, so it's really hard to like to process that specimen whenever we have it because it's just really short stability.
Right. So I guess the person receiving at the window has to kind of realize, like, all right, I have body fluids here. I'm getting blood from the outpatient labs. I'm getting blood from the ER, and I have patients dropping off here in stools. What's my priority? You know, where do I? Which I think that's kind of why we're all broken up to different stations so we can support each other. But that person at the window has to know, okay, what do I touch first? And we get also
Mhm.
specimens from outside clinics within
The clusters.
the sister medical centers and
Yeah.
hospitals.
Mhm.
Yeah,
What was I
which is
gonna
a
ask?
lot.
The one that you guys were talking about, what was the source? The cytokine.
Toxicities, usually blood. Yeah, most of the time it was
Oh,
always blood. Yeah.
I've never heard of that one because it's a send out test.
Mhm.
Um, what's
Yeah.
I don't even
So
think we
like
do those
how
anymore.
we really learn doing it, and even if we do, we actually had found another lab where the stability is a little longer, so we switch because the stability is just so short that it's really difficult to get a specimen to that in time, even though people are very vigilant about it, watch out, be prepared, be ready. It's just like traffic.
Yeah, it is.
Like that would have killed everything already, and it's just not practical.
I,
a lot of
So what would you say the most challenge that you face every day as a lab assistant?
good question. Um, you know what? Yeah,
demanding CLSs.
Mars.
Just kidding.
yeah, yeah. Having to talk to all the other staff members in the hospital. Just kidding.
Oh my god, no,
So
yours.
not like prioritizing, but like communication.
I think that's super important. Yeah, because if you don't endorse something, it will go missed.
Mm.
Yeah, yeah. I
Teamwork,
think.
guys. How often
Yeah,
would you say, okay, so a majority of your phone calls, how often would you say it's with doctors and or nurses? Almost all of them?
yeah. I want to say yeah, like practically all of them. Yeah. Maybe
What
we'll
do
get
they
like
want?
it's like
Yeah, what do they
my
want?
money. No, I'm just kidding.
Oh.
No, like
My
seriously, like
soul.
what do they want? Do they like a look that they're looking to add-ons, or they're looking like the results? Like what are they looking for?
Pretty much everything. Yeah, like if they want to do a test to a previous blood draw, they usually call us first. We
Oh,
transfer everything to the general
really?
lab.
Hmm.
And you know what? As I mean, this is kind of going ahead, but as a nursing student, I remember seeing their like extension line, and I think where it said like chemistry or something, it has our extension. So I think that's why we always get the calls for that at
Honestly,
least.
all of the extension lists throughout the whole hospital need to be like updated. I'm like, what is this? What is the actual? And then I call, they're like, oh no, this is postpartum.
Yeah,
And you can
yeah.
ask,
Yeah.
yeah, so,
Even like me, I get calls from, and then they'll be like, uh, I mean, sometimes they like, if I call someone like, hey, this is Peach, and then I state my business, right? Some people would just be like, "Oh," pick up the phone, or somebody picked up the phone and they just and be like, who are you trying to reach?
Yeah.
You? And be like, me? What do you need? How can I help you? And then they're like, I need you to dispense this, and I'd be like, are you trying to call lab? It's like, no, I'm calling you. I'm working in lab.
I haven't gotten those
Okay.
kind of weird calls. I get a lot where it's like, can you transfer me to micro? I'm
Uh,
sorry, sir. I'm sorry, ma'am. Or I'm sorry, doctor. There are more than one departments and we are not the transfer operator line. It does get a little, I mean, it's not terrible when it's one or two, but sometimes it used to be a lot all the time. And then if you're as a CLS, if your lab assistants are busy and you answer that phone call, it's kind of like a little bit of a wasted time, I want to say. But back on track. Back
Hmm.
on track.
oh yeah.
So, which part do we
Calls.
want to do? Are we
Calls.
talking about calls? I mean,
Mm.
okay. So, in my opinion, as when I was a lab assistant, I do agree that phone calls was one of the most difficult things to take on, especially when you're new because you don't really know how to answer questions, right? And I was just like, oh dear God. And then also like nervous. I think a lot of it is like why I didn't want to answer the phone. It's because I wasn't comfortable enough giving answers. Um, but that came as time goes on, being more comfortable as time goes on. But another very difficult thing I found as a lab assistant was sometimes like you have some very demanding CLSs, especially before. I feel like there were a lot more. They were like the kinds who were close to retirement, and with the big age difference, it's kind of like the age hierarchy where they feel like they can tell you to do almost everything.
Mhm.
um I feel like that was part of the one of the more difficult things. So it made me as a CLS be more thankful and a little bit more patient with my lab assistants, where it's kind of like, when you have time, can you do this? Or like, I need this right now, instead of like the frantic, do it, do it, do it. Um, but
I feel like I was like that too. When I first was a lab assistant, I think I feel hesitate and I used to pray, like, do not ring, do not ring. Like when maybe my trainer or like, more senior in the lab go on break or vacations or not vacation, sorry, break or lunch, I would pray and be like, don't ring, because I wouldn't know. And then I think like even like my that when you pray you don't want something, it will
more.
happen. So like I usually get like all these phone calls and then I was like, why can't you ask something that I know?
Yeah.
Like, I'm trying to help, but I just don't know. I can't answer those questions. Like I don't know them yet. It was like I think when I were more comfortable and get to train people, one of the first things I would train my follow lab assistants was how to answer the phone calls or how to answer that something that you don't know and nobody available to help at the moment. Just tell their names, just telling like, oh, sorry, I'm trying to help you, but I'm not sure about the answer. What's your names? What's your extensions? And let me get back to you. Just write those down. So tell them like, don't be panic. You're not gonna know everything. And even if people who work here for years and years, maybe one day they can get some question that they never been asked before. And just to have that, I guess, prompt where something was told to you, I guess, by more experienced people. I think that had helped my fellow to feel more at ease when they answering the phone. At least they're not panicked like, oh, what am I going to do, what am I going to say? It's like, it's okay if you don't know what to say, just, can I have your name, I will get back to you. And like, also tell them your name, like, if you need to follow up, here's my name. But also at the same time, make sure that you try to get that answer and get back to them as soon as possible.
Also try to learn from it, because even if you say, I'm not sure of the answer, let me get back to you, or let me find someone who can help you, don't just pass it off and then be like, whatever, because that question most likely will come up again. But I have
Mhm.
another thing actually that I thought of, the most difficult. So I'm trying to wager between unruly CLSs, like very demanding CLSs, or calling nurses, because a lot of the time, like, the canceling of the specimens is us
Mm.
lab assistants calling the nurses, right? At least in core lab, it was like, oh, clotted, hemolyzed, can you call? And they are so angry all of the time.
Yeah.
Yeah. Yeah.
I feel
So
like, oh, go ahead.
no, what is your guys' choice if you had to choose between?
I think I well obviously now that I'm more comfortable with the lab, I think I'd rather speak to a CLS.
Yeah, right?
Yeah, I think it's just because a lot of the time nurses, I feel like nurses should be trained in the laboratory. You learn a lot as far as what like how the background of it goes, rather than just like only patient care. It's different. One's analytical, the other one's critical, in a sense, right?
Yeah.
Uh,
Mhm.
but yeah, like I just feel like maybe they think like, well, how did that happen if I drew it right? It's like, well, did you draw it in the order of draw? Did you use the right needle? We're
I,
not.
Did
I
you know
promise
that
you, we're
you
not trying to call your
I
specimens.
actually really wanted to highlight this, but first, one point that I wanted to say is I think all of our CLSs now are pretty tame, which is why you don't really have very many angry people when you guys ask questions, or like, I feel like all of us also in Core Lab are very nice to our lab assistants when we ask for things, at least all the ones that we have now. But the other one that I really wanted to say is, Bridget, can you tell us how things hemolyze? Because the other day, I swear we had a nurse who called and was like, "Can you tell your analyzers to stop hemolyzing our specimens?" please.
Yeah, let
Can
me
you?
just punch in the code. Let me just. I
Yeah.
mean, I feel like a lot of it has to do with contamination. I don't know if they know how phlebotomists are. I mean, I don't know. I haven't done the blood draw rotation as far as nursing school goes yet. If they know like the order of draw and like what right needle to choose with the patient, if you're drawing from like even the correct vein, uh, smaller veins are gonna obviously not produce the kind of blood that like a big. I feel like a bigger vein would.
Mhm.
But I promise you, it's not. Sometimes like they don't even invert the tube when it should be. Yeah, that's like super
Mhm.
important. Like immediately after. I
Yeah.
think there's like a lot of factors that kind of play into that, but
So
I
to
feel like those are the main
clarify,
ones.
because these ones that we kept having to cancel that were hemolyzed were nurse straws. Sorry, nurses, I really don't mean to pick on you. It's just the ones who choose to pick on us back. I want to clarify this information. So if the needle is too small, right, that causes hemolysis, that's one of them. Um, so stop
Order of
using
draw.
butterflies all the time, right? Stop using
Yes.
butterflies. Okay, so
Yeah.
order of draw, that's a very important one also. What's the next one? Oh,
Inverting.
the way that the angle of the tube when you're collecting, right? Because if the blood shoots out and hits the tube too hard, can't that also cause hemolysis?
And leaving the tourniquet on for too
Oh yeah,
long
leaving the tourniquet on for too long, that can cause hemolysis.
And
or not putting it on at all.
the
Oh, I'm sorry, what?
not flushing the
The
line. So
line.
sometimes
Okay.
the nurse would collect it from the line, and the medications or depend on the fluids, whatever that's running. If they don't flush the line, it will, well, one, of course, is dilute your specimen. Number two, it can cause the blood to hemolyze. So hemolyze is happen 99.99999% outside the lab before it get to lab. So get it right,
Our
people.
our centrifuge
Collect the specimen
our centrifuges
correctly.
don't lyse the
I
RBCs.
know.
Our centrifuges don't
Oh,
lyse the
also,
RBCs.
like, I seen like sometimes like the nurses when they, well, not just nurses, whoever walking down the specimen, they collected already. Maybe they collected perfectly, everything perfect, but they're walking and then they're like toying with the bag, like swinging it. I'll be like, well,
Juggling.
wasn't
No.
Himalaya. If it wasn't Himalaya at the time of collection, I guess it's Himalaya now.
I think
Or
also
if they've been sitting up there.
yeah,
Oh,
right
that's
before
true
if they
also.
sit there and then are not centrifuged at the time, that is one. I think also we need to is this the technically processing, or should this be in the phlebotomy episode where it's like each container has its different weight, right? Like lavender tops, obviously they need to be mixed. Blue tops need to be because of the anticoagulants, but the gold tops, red tops, you don't have to. Those ones you want to clot. I think I've seen people like vigorously because they're like, oh, you have to
Yeah.
mix them, and then they like
Until it clots
Actually,
and
when I teaches my students for phlebotomy, I told them just to invert every tube.
I mean that's okay.
Invert, not shake.
Yeah,
yeah.
Invert every tube because even the one that's supposed to clot, it's depend on the tube. Some of the tube have a clotting
the
factor to
powder.
help it clot faster.
Uh,
So that's why you still wanted to invert it. There are like blank tube that doesn't have anything at all. But if you invert it, it's not gonna hurt
as long as it's gently.
as long as you invert it.
Yeah.
Okay, not shaking,
Yeah.
then it's fine.
Oh,
But there are tests that you need to shake.
vigorously. Oh,
Yes.
okay. I didn't know that. But
Yeah.
I
Quantiferon.
was just gonna say that. Our old
oh,
quantiference tube, you had to yeah.
Yeah.
Pretty
So like shaking like really hard.
yeah.
oh, that's a new one.
That's I was like, yeah, I'm honest, and we don't even know that a lot of the times they're hemolyzed until we spin them down.
Yeah.
You know
After
what I
we
mean?
spin them.
Yeah.
Oh yeah, that's true. Like you can't like tell like it was like I handed to you and you didn't tell me it was Himalayas, but now you call me that said it Himalayas, you Himalayas the specimen. It's like, no,
Yeah.
That's
I
probably
can't tell until it's spin down.
that's
So
probably definitely what they think. What was I gonna say about this? And our centrifuges would not be the ones that are hemolyzing it because we're validated. We do the testing to make sure this doesn't happen. We don't do
that's
things we
true.
don't do things nilly-willy here in the lab. Everything has to be
Yeah.
validated beforehand. Yeah.
And
So
everything, at least in my department, everything has like every specimen has its certain centrifuge at a certain time at a certain RPM or XG. Yeah. So we spin blue tops in a different centrifuge, and then we did with like our SSTs and red tops. So yeah, there's no way.
Yes.
There's absolutely no way. No.
Unless
I
it
mean,
sits for too long, like you were saying.
That too. And it sometimes it does take a while. Like I'll receive a specimen, like, oh, this was drawn like 2 hours ago. It's been mark collected 2 hours ago, and it's still not here. And then here comes, someone's dropping it off.
oh, you seen one that like only been 2 hours? I had seen one that was collected 2 days
I've
ago.
seen a body fluid that was collected 24 hours ago that they left in the patient's room. I should
Yeah,
probably cut
like I was
that
like,
out.
No, I know,
I mean,
yeah,
it's
same
fine.
here
Like
too.
we didn't
But
tell anybody names. I think it's fine. But like I had seen
Actually, yeah, because
little
that's
like
David's
someone
problem.
had collected and tried to submit that specimen thinking that it will be fine. And then when we looked at the date of collection, it's 2 days ago.
I mean, I don't know if this would be put in or not. But when I first started, I had a nurse that took the bots. I think this is what I gathered. She took the body fluid home with her and came back with it. So I was like, don't. Yeah.
I mean, things happen. I guess she probably put it in the pocket, didn't realize it, go home,
Yeah. I think
so
Marz
had to
got.
bring it back.
I think Marz is. Is it just me or is there camera?
Oh, I think she froze.
Okay. I thought she. I thought she was shocked. I thought she was shocked about my nurse story.
It's
Just
okay.
like
I think she will come back on in a little bit. Well, so now that like, you start working in a lab, working as a lab assistant, since you don't even like kind of know what it is when you start off, when you started, was it like a eye opener? Was you frustrated? Like how would you kind of rate or explain, I guess describe your experience?
um I mean, I think for me personally, I was really nervous. I was a little scared because I was like, oh, these people know so much. And I took notes like crazy, like step by step on what I need to do, how it where I need to receive it. um so yeah, I don't it was nerve-wracking at first, but like I think that a lot of the tips that people, and that's like the way I train now, is just kind of I'll throw in little tips because it's gonna become useful, in the future. Like sometimes we do get like blue tops where you're not supposed to spin. And I'm like, oh, let me make sure that you look at every test and what tube it's supposed to go in and what department is the one that runs it. At least that's the way like I train, just because I'm like, you're gonna get phone calls like that. So
Mhm.
when I first started, that's just kind of where I was like, oh, I don't know if I don't know. I guess it's just because I'm like, I kind of challenge myself, and I have like high expectations of where I am. So I'm like, okay, I don't know if I'll do well, but I mean, it all turned out okay, and really
You did well.
grateful. Yeah, really grateful for the experience. Yeah, you do learn a lot where I am, like a lot, and even sometimes doctors call us and they're like, yeah, I'm looking for a test that maybe can, I don't know, can you just tell me like what kind of test would find this and this gene out? And I'm like, oh, doc, you have to tell me what kind of test you want, and then I can tell you if we have it or not. I can't tell you what test runs what gene, or like what marker you're looking for.
I even have sometimes like I mean it's funny like the call we get. I have times where like the doctor call me and then tell me like I'm trying to diagnose X,
Yeah,
like a disease. Give me like a disease name. Like I'm trying to diagnose this. What test can I do?
yeah,
And be like, am I supposed to tell you?
yeah,
Or are
yeah,
you supposed to tell me?
yeah,
I've
exactly.
had that question. They
Yeah.
call and they say, "Is there anything else that will help me figure out if this patient has this?
I was like,
Is there
consult.
anything else I can order?" And I'm just like, "I'm sorry, doctor. Do you want me to transfer you to a pathologist to help you? Because I'm not allowed to give out that kind of advice."
Yeah,
I mean, they're right, like in the way they're calling us, because sometimes, not all the time, like because we work in the lab, we come across so many different tests, and like sometimes I know the answer, but I'm like, I'm not really allowed to tell you what to order. It's like against the law. Like I can't.
right.
It's kind of like for like frauds or like insurance, like wise, right? So you don't want I guess people keep telling like the doctor like I want this test, that test. It's kind of run into like different legal issues. So even though we know, sometimes we like would guide them. For example, like if they order um I don't know if this practice for every hospital or not, but like the hospital that I used to work, so if I perform a urine analysis and the doctor did not order a culture, some hospital would have it a reflex if it's hit a certain flags. It will be a reflex to culture because it's a suggestion of urinary tract infections. The one that I used to work at, they don't have that as a reflex.
Hmm.
So yeah, I would have to call the doctor and then like tell them like, hey, the nitrate is high, the white blood cells is high, critical high. And then I was like, okay. I was like, no, no, no. The nitrate is high, the white blood cell count is high. And then he was like, should I do culture? Do you think I should order the culture? I'm like, well, it's critically high. That's why I'm calling you. I feel like I'm telling you.
Kind of
You're
steer them.
suggesting, but you can't
Steer.
explicitly
Yeah.
say it.
Yeah.
Well,
Yeah.
no, I had one where it's kind of like it was a special case where they're trying to narrow down something. And so I couldn't actually give any advice on what that they were particularly looking for. I don't know. It was a very like weird question in which it's like, I'm sorry, doctor, like I really can't help you. That's why I have to. It's definitely on the level of doctor, not level of lab. The question,
Oh yeah.
but
Even
so
actually,
Or
as a lab
even,
assistant, we can't see results. Which we have had to
mhm,
yeah.
pass on to
yeah,
you guys out
that's
of our
true.
scope of
Like,
practice, as they say.
oh yeah, that's the more correct term. I even have like people's, or not people, like doctor calls and kind of like, oh, you know what? My patient is negative for this, negative for this, negative for this. Um, like, so what is the right, um, like diagnosis? I'm like, uh, how, I'm not sure how to answer that. Like, one, I never see your patients, I see the results. And like, I guess they were asking in a sense of like, well, because since we are
Teaching
doing the
hospital.
test,
Oh,
right? It's like, so we kind of know a lot of time, like we do know, like, oh yeah, this person has like, kidney issues, liver issues, like based on the test. But it's because of our license, like we are licensed to do different things, right? Like the doctor can't do our job. It's also illegal for them to perform lab tests. At the same time, we can't do their job, right? It's like different licensing issues. So kind of different specialties work together to get everybody, back to their health. But yeah, like some questions, it's just really interesting. Like, why are you asking me this question? Don't you have another,
consult.
your coworker, your colleagues, your attending, I don't know, your friends, somebody you can ask, or even, oh, I have this doctor calls. I love blood bank. I always kind of pick on blood bank, but they call me and be like, "Hey, I the patient is not bleeding, but but I'm considering giving blood to a unit of blood to this patient because the hemoglobin keep dropping, but there's no sign of bleeding. Um, is there anything wrong with this patient?"
That's good.
Yeah, so I was like, well, I can, have you consult with our blood bank specialist. But when I was looking at it, this doctor, since the patient is really sick, okay, to start off with, but the doctor orders so many tests, like
Mm.
so many tests on this patients. Uh, like the patient would get blood draw every hour, and the patient's been in the hospitals for two
Oh,
weeks.
that's why.
And then like I was like, no wonder hemoglobin keep dropping. The patient get blood draw every hour for 2 weeks.
And it's a
The
lot of
patients
tests.
came in with hemoglobin of 13 or 14, I forget. And then the hemoglobin drops to, at the time it wasn't criticals for transfuse. Yes, that's why he saying he's considering. The hemoglobin was 7.6, but it's going that
It's going.
direction.
Mhm.
I
I was
mean,
like,
I
no
guess
wonder, because you keep ordering tests
Yeah, you
every
keep poking the patient.
hour. And like it's the same test. I keep telling him that you order duplicate, triplicate tests. Like you don't need to run CBC every hour.
that's why it's dropping. No, we don't really want to deter doctors from asking questions though, because there are times where it's like yes, but there are just some times where it's out of our scope of practice that we cannot give that kind of advice for.
Yeah,
So
that's true.
they're
And
just trying to see where they can get help, I guess, and that's not
yeah,
terrible.
I do understand that also. So actually, like in the I guess, scope of things, I would rather have them ask. And then I said like, oh, let me get you to a consulting doctor or like a specialist, better than they're not asking, because um you know, one, the tests as they order could be wrong. And if I can help to prevent it, it's better for the patient anyways. Like the sooner you get to the diagnosis. Also, it saves costs for the hospital. But at the same time, like some of these tests, like don't you know the scope of practice?
It's
They're
okay.
like,
Yeah.
let me
We're a
ask the lab
teaching
assistant.
hospital.
I know,
We
right?
are a
Like,
teaching hospital. That's true.
oh yeah, that's true. Like, I mean, maybe this doesn't really apply to your hospital if you're watching, if you're not a teaching hospital, but we are a teaching hospital. So a lot of time these are like new doctors, and new doctor, it's everybody start from somewhere. So I'm pretty sure they will learn as they become or get more practice, right?
And you get a lot of travel staff too, especially like with nurses. So the practices that they do at different hospitals or medical centers, like I get them all the time where they're like, "Oh, well, at this hospital, we just stick the label in the bag. We don't have to put on specimen." And I'm like, "Oh,
At
not
this
here, not
hospital.
here. Here's some gloves. Please put it on there."
There's a
You know?
lot of things that
Yeah.
could go wrong. Oh my god, the blood gas. The blood gas. The blood gas. They
Yeah.
don't label them correctly. It gets me so upset when they bring them down and it's like they butterfly it on the syringe or something like that. It's not wrapped correctly, or I don't know. There's just so many ways, or like the label is just inside the bag, and then they're waiting there. They're like standing there waiting there for you to receive it, and it's like if you labeled it correctly, you'd be done by now.
Or
But because
yeah, even signing off. Yeah.
now I have to fidget with it and then try and get the label before I scan it, that's why you're standing like this. So please,
Mhm.
labeling of specimens is also very important.
I wonder if we can like keep taking pictures of like the creative way of people labeling their
I
tubes.
Tubes. Oh my
actually
god.
when
Yeah.
I actually did a project at work one time for like what is it? Patient Safety Week. I made a screensaver that was supposed to be plastered as well as like a board or something that they were supposed to put on display of all the wrong ways to label specimens. Let me see if I can find it. I know I blacked them out because we were going to put them on display for the so the patient information had to be blocked out. I'll at least show you guys. If it's bad, then I will not show it.
I remember. Oh, go ahead.
Go ahead.
I was just gonna say, like, I remember during that time too. Someone, it might have been you. Like, they printed out like a really informative thing, and it was like best dressed tubes, and then it looked, it
Oh,
was like
best
a
dress
fashion
tubes.
show type of thing. Yeah, and
I don't think that was
no,
me.
Mhm.
oh, then maybe not.
It was around like COVID times where I made that poster, and then that's why. Okay, no, that's
I think
the
ours
that
was
one.
But
like
I think I
labeling.
recall what Bridget was saying.
Best dress.
Best dress tube.
Yeah, and so
'Cause I
like
think I
a
see
certain
that,
way. Yeah. So
and then it's telling you like this is like, I guess, the best looking.
yeah, yeah, exactly. I wonder. I
This
always thought
is
that was so informative because I want to pass it out to to the staff. Sorry, I was gonna say nurses, but
I mean, like our phlebotomist also, right? So anybody who label doesn't have to be just nurses.
Right.
Um,
It's very frustrating. I hate double labels, and
Yeah.
it also
I do too.
delays
They're hard to
turnaround
centrifuge.
time. Okay, let me double
oh
check.
yeah, it's hard to centrifuge because
Yeah.
it's like we'll get stuck in the centrifuge, and then if the label rip off, it just, I guess, add on to like the delay in
Right.
specimen. Yeah,
Mhm.
and well, we
No,
kind of tangent
there's
on for a long.
this one. Some of the patient information on the other one was shown like date of birth, but this is one of the worst ones. So this is the bottom of the tube. I don't know if you can see. It's
Oh
four
yeah.
labels put together. That wonderful butterfly.
So unique. Yeah,
Oh
I
my
can
god,
see it.
focus.
I can see the.
That's terrible.
Yeah.
Let's see
Yeah.
if I have another one where it's not shown too much stuff.
Mm-hmm.
I like that you
But
have these
So like,
basically,
saved.
well, cause I did the thing. That was like one of the worst ones. But there's another one where it's like, okay, if this is the tube, and the label is like this way, butterfly this way. The label doesn't read on the instrument. It reads this way. Yeah, I don't know.
Oh, I
Or
know
the
what you mean.
window. The
Vertically
window.
rather than to the wall. Anyways,
Okay, hold on. This one, I think I can.
yeah,
No.
I don't think we can see.
You see the tube in the
oh, there you go.
background?
Yeah. Oh,
Oh, I can censor this if I decide to put it. But this is wrong.
how many do they have on there? 3?
Yeah,
Yeah.
I don't think I'm gonna
Watch
show
it
that
be one
off.
of our lab assistants who did it that way.
Oh no, these were my examples that I made
Oh, okay.
because we didn't want like people to put. But I've seen it. I've seen it like that.
Oh yeah. They're like,
Mm,
oh,
yeah.
if it's on the poster board, maybe I should do it this way.
Mhm.
Context clues. Context clues.
Instead of like not do it,
Yeah.
but like, oh, let's
Oh, they
They're
do
want
like,
it.
it this way.
oh,
Yeah.
that's how they wanted it. Yeah.
Mhm. So, I guess did you tell us how long have you been working as a lab assistant? Sorry, I don't know if we get that.
Hi.
Did you?
Well, I started in 2018 as a lab assistant, and I want to say maybe 2020 for like a year and a
So
half. I was a
to
phlebotomist, and then I went back to lab assistant because I got the permanent position as one. And I think that was like in 2022 or 2023.
so all together maybe 4 years, just as
Yeah,
like the lab assistant parts.
approaching 5. Yeah.
Mm.
Mhm.
So, would you say that um the positions like the lab assistants kind of fulfill you as like a personal level, because like you said you like working with people, right? You're always work with people, like helping. Does it help you like fulfill that part, or it just like a job?
I think for me personally, I think it is fulfilling. Although it's not centrally like patient care like how it is as a nursing student or a phlebotomist. I think that there have been moments where a doctor can really appreciate you kind of going above and beyond, looking for an answer or searching for a test or helping them, walking them through on how to order something, even as simple as ordering something or where they can find like a miscellaneous slip that they have to order or what alias is a certain test that they're looking for in the system. Even, I mean, where I work, we do sometimes interact with patients. And I mean, that's always kind of fun too. Like they're, for the most part, like our outpatient people, they're kind of, I mean, I like talking to them. I know that they're not in the
Mm-hmm.
best place to socialize. Obviously, it's a hospital, but yeah, I mean, for me personally, I think it is fulfilling, especially when you go recognized as a lab assistant, even for doing certain things, and
Yeah, that's
they do
true.
rely
Like
on
to
you.
me, yeah, I did find that it was fulfilling, even though I think, like Bridget said, even though it's not like what you said, like patient care. I wanted to say that lab assistant does perform patient care. It's just that they don't face the patients like face to face. But without lab assistants, a lot of the things will get delayed. The cost of the healthcare will be higher. um a, a lot of time they do a lot in the background. It's just because you don't see them doesn't mean that they're not, I guess, performing the patient care functions. They are, and they're really essentials to us, at least like where we are.
A
Like
good lab assistant can really help streamline the process, and things go a lot faster and smoother um, if they help out a lot. Uh,
especially if you're efficient.
yeah,
yeah,
yeah.
good lab
Yeah,
assistants.
yeah. If you can,
Like there are
yeah, yeah.
lower performance ones and they're like a
No.
high performance lab assistants. Like I would say like um this is not at this hospital, like the place I used to work at. We used to have 3 lab assistants, and then let's say 2 were not performed. So they got removed, and then we just have that like 1 lab assistant, but the 1 lab assistant that we had, she was really good at what she's doing. And so we actually prefer to just have her. And even like for her, like you would say that like, or would think that she said like, oh, this is too much work. But when we were talking, like she said she actually prefer because there's no like conflict. Yeah, there was just like a lot of like personnel issues, I think. So and then she's very performed, she's like a highly performed lab assistant. So the lab was able to function more seamlessly, actually, like more efficient with just having her than having all 3.
Like
So like lab assistant does help us out. So when you were considering becoming like a phlebotomy, have you considered becoming a CLS?
Oh yeah. I think with right now, I don't know if you guys noticed that like our hospital, we had a rotation of like students come in every once in a while to kind of, I think it's throughout the entire
yeah.
hospital, just kind of see like where they would want to be as far as like healthcare goes, because obviously there's different fields. And I was like talking to one of my coworkers, like I wish I had that kind of opportunity to see what other, jobs there are within like a hospital, because there's so many. Um, and I never knew about what a CLS was until I started working as a lab assistant. And I think it's a really good step to start at if you want to become a CLS. Um, but also, I think for me, because I'm going into more like patient care, you, the patient care route as far as a nurse goes, I you kind of start to put together like the backgrounds of how things work or why things work, uh, because it all starts
Like,
obviously. I mean, at least it ends with lab. Not
mhm,
people.
why
I
thing
kind
works a certain way,
Mhm,
right?
mhm.
I kind of really want to stop the volunteers every time they come down and drop off the blood gas. I'm like, hey, do you kind of want to see what I'm looking at the
Ah,
microscope
dude,
or like something like
yeah,
that?
I love being
Just to be
pulled for
like,
that stuff.
because
Yeah.
we have I think high school students coming again sometime this month, and I have to give them the little orientation.
Sorry, my
But
Teams is on.
it's okay. There was something else that I wanted to highlight about that. Hmm.
The students, I think
Mm-hmm.
I like that too. Like I didn't have that when I was in high school. That's why it took me a really long time to even kind of find my way to become a CLS. I think if I had it back then, it would be more direct
Yeah.
like approach for me, because I always like lab. I know I don't want to work, even though I like working in the hospital, I like helping patients, I like working like knowing that I make the difference and help somebody becoming healthier, even just their regular checkup. But I also know that I don't want to face people. I don't know, it's kind
It
of
is
weird.
hard. It's
Like,
hard.
yeah, like I don't want to face them. I think it take a different personality. Like in healthcare, like you need more, like if you want to, how does it, people, like person to person interactions, maybe like the nursings would be, or nursings phlebotomist or like doctor would suit you better than in a laboratory setting. But I know I want to provide all those care, but leave at the same time, kind of leave me alone.
Yeah. I think that's where my mind
So
wanders sometimes too, where I'm like, okay, well, I don't have fun in nursing, then at least I know what the lab is about. I can just, I mean, part of me sometimes like, should I work part time nursing and still be a lab assistant? That's, I mean, it is nice. It is a fun job, especially when you get really used to it. Like you have your routine, you're, you know, you're busting out tests and specimens and this and that. I mean, we have a really good lab assistants, at least as far as where our center is. I think. Um, so it's easy to approach them. It's easy to ask them questions. Some, not all, but I think like as far as my team goes, I think that we have some pretty good people. Where like if they weren't there, I'm like, oh, I don't know how this place would run. You know,
Mm.
so better Marz.
Mm,
But yeah, I mean, as for
no.
like our senior labs, our two senior labs that we have, I, I, I commend them. They do so much, and on top of that, they do what like they kind of fill in for us when we're not there either. So
Yeah.
good team.
Yeah, go team. So teamwork is really important in the lab. Looking back and knowing everything that you know now, as like with 4 years experience being a lab assistant, what do you think would be your advice giving to somebody who is interested in becoming a lab assistant, and like what like quality you know of a person do you think like they need to have to be a good lab assistant?
I think, like every other job, you have to be like. I think that you have to be pay attention to detail. You have to be detail oriented. Um, Also, like self managing, task oriented. Uh, just because, as far as
Mm-hmm.
like my departments, you have times where certain couriers come in, so you have to know what test to send out by this certain time or this certain time. And sometimes like you'll be asked by different people, like, "Hey, can you look into this?" Or different doctors, right? Look into this for
Mm-hmm.
me and this, and then like you're taking care of your specimens and stuff like that. But I think that, I mean, as someone who came in there with like very little background, I think the only laboratory background I got was, during my prerequisites as far as like whatever chemistry, or biology or physio, all those core sciences. I mean, like I didn't. I think even the supervisor that ended up interviewing me at the time was like, all I knew was how to use a glucose monitor, and she was a supervisor. So I think that if you're trying to see if you can get background on how things are like analytically, I think definitely going into lab assisting and then going to CLS route is probably a good option. And if you're a softie like me and really really super empathetic, then I went down to nursing, so we'll see how that journey goes.
I think lab assistant is a great career and even a good stepping stone if you
Mhm.
want to keep moving up. One of my recommendations, though, if you plan on becoming a lab assistant, is customer service because you're gonna have to take a lot of like sometimes angry phone calls or make phone calls that will make other people angry.
Yeah.
So I think I had to learn how to have a better customer service voice um, as a lab assistant, and I think it did help me be a better CLS. Also,
Yeah, especially with doctors. I was scared to talk to them. I like
me
just
too.
it was intimidating, and they would tell you like all these different names, and I'd be like, hold, pause,
Hold
hang
on,
up,
please.
hang up, and just be like, all right, they'll call somebody else. No, just kidding.
Yeah.
But yeah, I mean, it does help you, and a lot of the times I could not understand what you can't if you can't understand what doctors write, you can barely understand sometimes what they say. So it takes a
Oh,
while. Yeah, I'm like, what tests are you talking about? Now I'm just like, oh yeah, this is collected in a red top. It
it
just takes
does
a
take
while.
a while
It's some
to
lingo.
become comfortable, and there are still things that even I still have to ask other people. There's
Yeah,
just
same,
so many tests.
same.
Yeah.
So,
Actually, I ask Bridget a lot. I ask the lab assistants a lot about like the send out tests because they are more familiar with them than us, sadly. But
also,
like again, like those tests, like sometimes people can learn, like like the test that the doctor are referring to. Everybody can learn. The name of the test is just the name of like a person. Just think of it's a name of a person. Anybody can learn those name. It's just like how you label something. It just if you take time, do you dedicate it yourself to improve? If you are you will be better. You will be a better lab assistant. You will be more equipped like the next time you come across that, and then you'll be a very like a helpful, you'll be access to the team, you know. So just like to me, I think the greatest quality is the willingness to learn.
Oh, definitely.
Yeah.
And initiative. Take initiative.
Hmm.
Yeah.
So,
A little bit of
yeah,
humble
Mark, so
pie.
what?
Huh?
Oh yeah,
A little bit of humble
that's
pie
true.
also. Because
Hmm. Yes, yes, yes.
as a person, I didn't know anything, and I definitely think that I'm thankful for having been trained by really good people. Because if I hadn't, I don't know how I would be as a lab assistant.
But see, like, cause you're willing to learn, like you're trying to better yourself, right? So it, like, to me, like it doesn't matter how good your trainer are. There are people who will just not learn. I want to do the bare minimum, and this is what I'm gonna do, and that's it. And they would, you know, they don't really add value to the team. They just add volume. They're
Oh, that's a good one.
sometimes not um like, you know, those people, like, you know, if we can live it out one day, you know, you will be without us. That's
I
Yeah.
think
pretty much
sometimes some lab assistants don't realize the scope or like the impact that they actually make on the
the
lab's role
labs.
of
Yeah.
patient care, because inventory is one of the ones. Like even though they're not directly performing the testing, if we don't have some stuff of our inventory, we're screwed. So
Mhm.
um they play a huge part in the patient care.
Yeah, the lab assistants are. So really commend you for it. We really appreciate you, Bridget. You know, as a person, as a lab assistant, the role you play, you did very good job. And I think
Likewise.
we don't do a good enough job of like appreciating them, like, you know, daily. But lab assistants are very essentials. I think they're essentials to our teams. And I
At least we
guess
get lab week.
at least you enjoyed that week,
Yeah.
right?
I was like, if not every day,
From
at least we have lab week.
Uh-huh.
Peach's
Yeah.
organization of Lab Week is what makes Lab Week. The hospital doesn't
Yeah.
make Lab Week.
Yeah.
But don't we'll not go into that anymore. Anyway,
Yeah. I was like,
So
so
like
thank you to all the
what
lab assistants that do a good job. I mean,
yes, thank
at
you
the end
to
of the day,
all.
it is patient care. You know, you are helping a patient. So if something goes wrong, you know, you want to be like, quick to catch it.
Yes, that's true. Like, and a lot of times we are relying on our lab assistants to a certain degree as well. How would you like, if you can go back in time, would you still make the same decisions of becoming a lab assistant?
So far, yeah.
You don't
Yeah,
know when I
it's
walk
like,
into
yeah,
work tomorrow.
yeah, yeah. I'd be like, oh, can we erase that from the podcast?
I'm gonna call you up how many times? Bridget, I have a question. Bridget, I have a question. What's your question? How are you doing? That's
Yeah. I was like, the burnout can be real. It can be.
Uh-huh,
Honestly, it
that's
can be.
true.
Yeah. But I mean, yeah, I wouldn't change it. I think it's really guided me in knowing a lot of things. When I started off as a nursing student, I was like, I got this. I know my tests. I know why they're performed. Yeah, it's a totally different world. But it's just kind of at some point in that path, they kind of interject. So they cross the path,
Mhm.
and I think that yeah, I wouldn't change it. I think that if I could change anything, I wish I would have explored my options as far as like healthcare field, just because a CLS to me, like, yeah, becoming a CLS is really important. I think that I really do enjoy being in the lab, and a CLS is a really intriguing job if that's something that you enjoy doing. And unfortunately, fortunately and unfortunately, I think I took my steps into more nursing because that's kind of like what right? Become a doctor, become a nurse, not knowing that behind the scenes you have lab assistants and CLSs. You
I
know?
think you're gonna be a very good asset though to your future coworkers.
Mhm.
I'd be like, did you scan
Anytime
that?
Yeah, not only that, but like
Do you know the
they'll
correct order
complain.
of draw?
They'll
Yeah.
be like, "Why is my specimen always hemolyzing? Why is my specimen always clotting?" Like,
Yeah.
And then you just turn around and be like, because you did it.
Yeah. I was just like,
let me help you out.
yeah. I'll be like, tune into the Blood Talk Small Talk podcast at this timestamp, and you'll know why it came out hemolyzed.
No, it'll be like, go follow their Instagram. I'll send you this reel.
Yeah, yeah, exactly. We'll use hashtag. Mm, yeah.
Yeah.
But
Well,
thank you. Yeah,
with
thank
that,
you.
yeah, with that being said, so thank you so much, Bridget, for being with us today. We have exchanged a lot of our I guess background. It's bring back a lot of our memories, and I hope that what we kind of talk about today helped you guys out there, whoever is watching this, to make a decisions if you are interested in becoming a lab assistant, or you interested in getting a career in a healthcare setting. So a lab assistant is an option. Stay tuned for the upcoming episode because we will be talking about phlebotomy. How like the day-to-day life as a phlebotomy. What you need, what trainings you need to become a phlebotomist, and also next, after phlebotomies, we will have another episode with our guest Bridget as she's transitioning to becomes a nurse. Right now, she's in a nursing school, so stay tuned. We can move our progress along. Her journey from scrub to nursing school. A nursing student right now, but soon to be a full-fledged nurse.
Thanks.
And always remember your blood tell you the story of your health. Thanks for watching. Bye.